Hello everyone. In one of our previous videos, we discussed about the PDA updates of 2026. After watching that video, many of you have asked me that there are so many diabetic medications nowadays. So how to choose the right medication and what factors to be considered in different patients when we are going to select the anti-diabetic medication. So that part we will discuss today. See, whenever we are in doubt, like how to start anti-diabetic therapy. Here, to simplify this, what we have to do whenever we are considering diabetic medications, we have to think of a sentence. We have to question ourselves this sentence. Just a faint smile and ask, who knows glucose control? This point we have to remember. And the answer for that will be Miss GDP. So these two things we have to remember when we are considering anti-diabetic therapy. So based on this single image, or we can consider it as a simplified way to remember, we will discuss today's topic. We will make a column in which one side we will enlist the medications which are there for diabetes therapy. And on the other end, we will consider the factors in every patient. This will be our way of approach. So we have made some columns now. We will start filling them according to the sentence we have told. So on one side, we will enlist the drugs which are available. So here comes Miss GDP. M in the sense metformin. I is insulin. S is sulfonylureas. One more S is SGLT2 inhibitors. G stands for GLP-1 receptor agonists. D is DPP-4 inhibitors. This P, we can consider it as alpha. So just remember, this P is from alpha. That is nothing but alpha glucosidase inhibitor. These are the drugs which we have in the list. And what are the factors which we have to consider? As we told, it is who knows glucose control. So according to that, H stands for heart. A is any atherosclerotic events. One more H stands for hypoglycemic episodes. A is adverse events. This W is nothing but weight we have to consider. K stands for kidney health. G is glycemic control. And this C stands for cost. So these are the factors which we have to consider whenever we want to choose anti-diabetic medication in every individual. So we should start considering each of these points for each of the diabetic group of medications. We will start now. When it comes to metformin, this M, we know that in heart health, it has potential benefits. And in atherosclerotic events also, it has proven potential benefits. When it comes to hypoglycemia risks, we know that there is very low risk of hypoglycemic events. And adverse events, mainly we know that it can cause lactic acidosis, especially when there is risk. For example, if there is dehydration, or the patient is in shock, or admitted for acute decompensation of heart failure, if there is AKI. So these are the conditions in which there will be already risk of increased lactic acid. So in such situations, using metformin can lead to lactic acidosis. Otherwise, it is very safe drug. And regarding weight, it is weight neutral That is, it will not cause either weight gain or weight loss. So weight neutral. And when it comes to kidney health, especially CKD, again it has neutral effect. Not detrimental also, not beneficial also. And glycemic control, the efficacy is very high. When it comes to cost, we know that it is one of the cheapest drug available for diabetes management. So cost is low. Similarly, for insulin, we know that regarding heart health benefits, it has no much beneficial effects, so it is neutral. Atherosclerotic events, again, neutral effect. Hypoglycemia risk is very high. Adverse events, mainly we know that hypoglycemia will be more and there will be weight gain chances. So these are the two important adverse effects, hypoglycemia and weight gain. Similarly, in weight column, we can tell that it has the potential to cause weight gain. Regarding kidney health, again, no positive or negative effects, so it is neutral. Glycemic control, highly efficacious, because we compare the HbA1c lowering effect of all other groups with insulin only. Coming to cost, if it is human insulin, cost is low, but if we want to use analogs, cost is higher. This point we have to consider. Next one is sulfonylurea, one of the oldest medications in diabetic management. It has almost the same effects just like insulin. So when it comes to heart health, it has neutral effects. Atherosclerotic event prevention, neutral effects. Hypoglycemia risk is higher again. Adverse events are similar to insulin. Again, there is chances of weight gain. Kidney, neutral effects. Glucose lowering effect, yes, it is one of the efficient group of drugs. Cost is very low. So these are the factors related to sulfonylurea, for example, glimepiride. Next is about SGLT2 inhibitors, especially dapagliflozin and empagliflozin. So we know that it has potential benefit when it comes to heart health. So beneficial. Atherosclerotic events, we can see lesser number of atherosclerotic events when we start using SGLT2. So it has benefit here also. Hypoglycemia risks are very less. And adverse events, we know that there will be chances of urinary tract infections and limb amputation risk. So these factors we have to consider. Like suppose the individual is having recurrent UTIs, we have to avoid this medication if they are not able to maintain the hygiene especially. And limb amputation, if the diabetic individual is having any issues related to foot, we have to be careful when we are using SGLT2 inhibitors. When it comes to weight, it has shown that this group of drugs will cause weight loss. So very helpful in obese diabetic individuals. Kidney health, again, beneficial. Glycemic control, it has intermediate effect. Like not too high, not too low efficacy. And cost, it has also come down now. We can consider it as lower cost only. Next is about GLP-1 receptor agonist drugs, for example, semaglutide, which are in talk nowadays. We know that it has beneficial effects on heart health, atherosclerotic events, and as it acts through incretin effects, hypoglycemia risk is lesser. And adverse events, I have already made a video, short video about the adverse events. So we can remember that using GLP-1 receptor agonist itself. G stands for gallbladder pathologies. L is lean individuals, we cannot use it because of significant weight loss. P stands for pancreatitis risk. R is retinopathy. So you can watch that shorts if you have not watched it. When it comes to weight, significant weight loss. That's why it is being promoted for obesity also. And kidney health, it has potential benefits in CKD. That's why it is considered as one of the important medication in the CKD management now. And glycemic control, it has very high efficacy. Like we can see immediate lowering of HbA1c. That's why there will be risk of optic nerve ischemias. And when it comes to cost, it is still higher. This is the only problem with these group of drugs. Next group of drugs are DPP-4 inhibitors like vildagliptin, saxagliptin, etc., sitagliptin also. So here these group of drugs have shown neutral effect when it comes to cardiovascular benefits. Again, neutral effects. But here the thing to remember is saxagliptin is actually harmful when it comes to heart health. Hypoglycemic events are lesser because these drugs also act through incretin effect only. Adverse events, just like GLP-1, we can consider there will be risk of pancreatitis, retinopathy also. Coming to weight, we can say that it has not much effect on weight loss. So it is neutral when it comes to weight according to the trials conducted on these group of drugs. CKD, again, no much help, neutral effects. Glycemic control is intermediate. Cost is average, like moderate cost we can consider. So this group will be beneficial when we consider them as add-on therapy, not the single agent. That point we have to remember. Finally, regarding alpha glucosidase inhibitors, especially acarbose or voglibose type of medications, here they don't have much beneficial or harmful effect on heart and kidney health. So it is neutral. Here also it is neutral effect. Hypoglycemia risks are lesser because it acts mainly for postprandial glucose control. Adverse events are gastric related, like patient will feel gastric distension, flatulence, abdominal discomfort, etc. That's why it is advised to take with the first bite of the meals for this drug. When it comes to weight, it is weight neutral, not much beneficial in weight control. Kidneys, as we mentioned, neutral effects. And glucose control, we can say it is intermediate efficacy. Mainly for PPBS control, we can add this drug. And cost is lower. So these are the points related to alpha glucosidase inhibitors. So according to this table, the overall point is whenever we want to start or consider anti-diabetic medications, we have to remember this sentence and we have to try to fit in all these points for every individuals, because some may not be affordable. So we have to be focusing on the cost of the medication also. Few people will be obese, few will be maintaining the weight, few will be lean. So according to that also we have to consider the thing, and we have to check for any potential atherosclerotic established events, or the individual might be at risk of developing one such event. So in that case, we have to choose medication which is helpful to cardiac health. Again, CKD also, because many diabetic individuals will develop chronic kidney disease. So we have to consider those medications which are beneficial for kidney health also. And when it comes to elders, we have to be very careful regarding hypoglycemic events because it can be detrimental. So in that case, we have to consider the medications which have very lesser or no hypoglycemic risk. And finally, we should also consider adverse events related to that particular group, because some may not be comfortable with the metformin causing gastric side effects. So in that case, we have to consider other medications also, or we have to advise them to take the medication after meals so that their discomfort related to the medication will come down and the compliance will increase. All these factors we should consider for every patient when we want to give appropriate diabetic care. I request you to make a tabular column and attach it at your OPDs or ward side or your room, so that you will be looking at these points every day, so that it will become a practice for all of us. Because there are numerous anti-diabetic medications, probability of getting confused or using one particular drug will be definitely difficult. So hope it helps. Make use of this tabular column and share it among all your friends. Thank you so much.